Hi, I'm Marielle, and I'm one of the physical therapists here at University of New Mexico Hospital.
And I'm Rosemary, one of the occupational therapists here at UNM Hospital.
And today we're going to discuss what to expect after your total knee replacement. And we'll make modifications to your plan of care based on your needs to make sure that you can leave here safely. So you are on a track to go home in 2 to 3 days. Post-operative day number 1, physical therapy will come in and we will go over exercises, which we will review today. We'll also go over getting out of bed and some walking. Post-op day number 2, physical therapy will see you 1 to 2 times, and again we'll go over the exercises, getting out of bed and walking. Also stairs if you need to do stairs when you go home. And then post-op day 3, again we'll see you 1 to 2 times, and we'll go over anything we need to fine-tune to make sure that you can get home safely. So after surgery, your doctor will give you something what's called a weight-bearing status. We have what's called weight-bearing is tolerated, which is as much weight as you can tolerate. There's partial weight-bearing, which is maybe 50% of your weight-bearing through your leg. And then there's touchdown weight-bearing, which is for balance only, as if your toes are just hitting the ground. And then there's non-weight-bearing, which is like it sounds, is no weight whatsoever through your operated limb. So that first day when physical therapy comes in, we'll come in with a walker, and if needed, we'll progress to crutches. And as I said, we'll work on getting out of bed. And also we recommend that before you come in, you work on standing without using that leg. So if your right leg is getting operated on, we recommend you work on standing up without using it. The reason being is after surgery, you're heavily going to rely on that leg that's not operated on, and you're also going to rely on your arms. So now what we're going to do is we're going to go over the exercises that we would like you to start today, and then we're going to have you continue them after surgery. And Rosemary here will be demonstrating them. Okay, so we're going to say that it's her left leg that got surgery on it, but we also want you to remember that we want you doing these exercises on both legs, not just the one that got operated on. So the first exercise is what's called ankle pumps. That's when you're pumping your ankle up and down. And you can do them one at a time, or you can do them together. And we want you doing all of these exercises 2 to 3 times a day, at least 10 times. If you can only tolerate a couple, work up to 10. We don't want you working into the pain. The next exercise is what's called quadriceps. That's when you're going to tighten your thigh muscle. You're actually going to try and push your kneecap into the bed. So you can see that Rosemary's muscle right here is tightening. The next exercise is what's called gluteal sets, and you can do these along with your quadriceps, which is tightening your buttock muscle. Perfect. And those you'll do at the same time. The next one is what's called heel slides. So what you're going to do is you're going to slide your leg up, and then you're going to slide it back down. Perfect. And again, you'll be doing this on both legs. The next exercise is hip abduction and adduction. That's where you're going to bring your leg out to the side and back in. And we recommend that you don't wear shoes while doing this because it can actually cause some friction. So maybe having some socks on while you're laying on your bed will make it a little bit easier. The next one is what's called short arc quads. So with this, I'm going to steal one of your pillows. What you're going to do is you're either going to put a pillow, a towel, a coffee can, anything like that underneath your thigh, and then you're going to kick your leg straight up, and you're going to hold it for 5 seconds. Or you're going to hold it for as long as you can tolerate, but up to 5 seconds. Perfect. And again, you're going to be doing both, but we'll only demonstrate on that one. The last exercise that we want you to work on is something what's called straight leg raises. That's where you're going to bend the opposite leg, and then this leg you're going to bring up no higher to where your knee is. Perfect. And if you can only get half the distance, that is okay because you're still working on strengthening your hip muscles. Perfect. The last thing that I do want to bring to attention regarding exercises will be more so affecting you after surgery is what's called a supine knee stretch. So after surgery, you're going to feel very comfortable in this position. However, we're going to be very, very adamant that you work on keeping your knee nice and straight and keeping your kneecap pointed to the ceiling. The reason being is that after surgery, we have a certain window to help get your knee back to being straight like your non-operated limb. And what can happen is if we miss that window and your knee gets stuck in this position because all of that elasticity is gone and we can't stretch it anymore, you actually might have to go back into surgery. So we really, really want you to be aware of that. And if you need to put a pillow or something, you need to put it underneath your ankle and not underneath your knee to give yourself a nice little stretch under there. Okay, so those are the exercises that we want you to start doing, starting now.
On the first day after your knee surgery, an occupational therapist will come in and evaluate you. They will go over arm exercises, self-care tasks, home safety modifications so that you are safe when you go home and get you as independent as possible. We'll go over dressing, bathing, toileting, depending on your needs. With dressing, you always want to dress the affected side first, and we'll go over that a little more in detail depending on your limitations. We'll also go over you getting in and out of bed, sitting and standing, so that you can complete your self-care tasks. Now, the exercises that we recommend that you do before your surgery and then after your surgery are, when Mary Ellen will show, are bringing your arms out, off from the side towards the front, bringing them up, and then slowly lowering them down. And to make this exercise a little more difficult, you could hold any kind of can or water bottles that makes it a little more resisted. The next exercise is Mary Ellen will bring her arms out to the sides. And same thing here. She could also hold on to some cans or water bottles. We're trying to strengthen the shoulders because we're going to rely on the shoulders and the arms and that one non-operated leg when you are after your knee surgery. Our next exercise is one of the most important exercises. We use our this motion a lot to get up from any kind of surface. So she will place her hands on the chair, and they're called dips. So what she does is she straightens her elbow, comes up to a straightened position, not locking out her elbow, and then lowering herself down, and then doing that again. So we're strengthening the back of the arm, which this motion we use to get up from a chair, get up from the bed, get up from your wheelchair, use it on your walker. This is the main part of your arm that we really want you to strengthen. So I recommend you do these about 2 to 3 times a day, 10 to 15 times, and make sure you're doing them before your surgery so we can have stronger arms. So now we're going to demonstrate how to get in and out of a tub and off and on a commode. Mary Ellen's going to demonstrate as I explain. So you walk with your walker towards what's called a tub transfer bench. She turns all the way around, pretending this is almost just a chair. She turns all the way around until she feels it on the back of both her knees. When she's there, she reaches back with one hand, not on the armrest of the tub transfer bench, down into the seat, because if you reach here, it could tilt, so you don't want to reach back here. She sits down. She places her walker somewhere off to the left or right in front, as long as it's within reach. You don't want to throw it out too far because then how are you going to get it when you're done? You need it when you get out of the tub. So then she scoots back a little bit. She pivots over to the right. She takes her operated leg in. If she can lift it on her own, that's great. If not, you can help with your hands. There's also a leg lifter that you can use that I'll demonstrate here in a little bit. Once she's inside the shower, we recommend you have a handheld shower or here, which makes it easier to reach your different parts of your body. If you don't have a handheld, it's okay. You can just use a regular shower head. The most important thing is before you get out of the tub, you want to make sure you're dry, make sure your feet are dry. You want to have installed some grab bars, not the suction ones, but the ones that actually drill onto the wall, because the suction ones, are very easily to come off, especially with moisture. So once she's done from there, she scoots out a little bit. I'm going to stand over here. She takes out her non-operated leg. She takes out then her operated leg, pivots all the way around, From here, you make sure you're completely dry. We don't recommend you walk barefoot or you walk with socks. Always have some non-slip socks that you can put on or some shoes that you can walk out of the bathroom with. She grabs her walker, uses one hand to push off from the chair, stands up, and she's ready to go. So now I want to demonstrate how you get off and on a commode. We're going to pretend that this is our commode here. We don't have one. So we would prefer that you have what's called a toilet safety frame, and it attaches to the back of your toilet. Now, if you can't get one of those, we have some modifications, and one of them is Mary Ellen will demonstrate walking up towards the commode. So pretending this is the front of the commode, this is the back of the commode. She's going to bring her walker all the way until it's completely over the commode. Then she will turn around and use her walker as her grab bars to assist her in lowering herself down and then to assist her to stand up. And she'll turn around, grab her walker, and walk out.
All right, so the last thing we're going to demonstrate is if you have that little threshold to get inside of your house. So after surgery, you're going to want to definitely be going up with your non-operated limb and down with your operated limb. So coming into the house, there's two ways to get in. Sometimes you could come straight up to that step, bring up the walker, bring up your non-operated limb, which is going to be Rosemary's right leg, followed by her left leg. But sometimes people find that really difficult because of the fact that now their walker is already in the house. So another way to do it is, I'll have you come back, is actually to go into the house backwards. It might sound a little weird, but it's actually a little bit easier. But you're going to be going up with your non-operated limb first, followed by your operated limb, and then you bring the walker in. So that way you can still use your arms. And if you are touchdown weight bearing or non-weight bearing, we're probably going to have you doing it backwards. And then to go out, it's just going to be the opposite. You're going to do the walker first. This time your operated limb is going to go first because your non-operated limb, that right leg, is doing all of the work to help you get down and out of the house. All right, so the last thing we're going to go over is if you have to do stairs when you go home. It is the same concept as the curb step or that little step into your home. So basically what you're going to do is you're going to go up with your non-operated limb, which is Rosemary's right leg. She's going to use the handrail and push up and then bring up that left leg, followed by bringing up the walker. And then she's going to do the same thing again. So right leg and then left leg. And every therapist has a different technique, but this is the same sequencing where it's going to be the non-operated limb first, followed by the operated limb. Going down is just the opposite. It's going to be the assisted device first so that you can have a little balance while going down. And then you're going to go down with your operated limb, followed by your non-operated limb. And always making sure you're holding onto a handrail if you have them, because those are much more sturdy than an assisted device. Now Rosemary's ready to go.
So now I'd like to talk to you a little bit about some home modifications to make your home safer for when you go home. We'll start off talking about the bathroom, and because that's our primary place where most of our accidents happen. So what we recommend is you use a tub transfer bench, a handheld shower, some grab bars. You want to double check to see if you have sliding doors that you'll have to remove so that your tub transfer bench fits in your shower. We also recommend that you use a non-slip mat on the floor. When you are planning for post-op after your knee surgery, we want you to consider maybe having already your meals cooked and frozen so it's easy for you to just unfreeze and you don't have to worry about cooking. Moving your objects that are really low surface or at a really high surface and kind of putting them somewhere between your head and your waist is kind of like the general guideline so that you're not doing too much bending, too much stretching, and then risking falling. We also want you to consider removing your throw rugs. Those are our #1 trip hazard with our walkers. Also, making sure your furniture is arranged well so that you fit in your house with your walker, considering the height of your couches, if they're too low, too soft, too hard to get off of, your bed as well. And also, considering you might have to be doing laundry and cleaning, if at all possible, you could have somebody there with you within the first week after surgery. That would be ideal. If not, all these pre-planning is going to make your recovery a lot easier and quicker. We will be giving you a handout at the end on the day of discharge, or even before then, so that you can kind of have a general guideline as to what you can do so that you can be safe at home and independent as possible.